Bienvenue à
Good afternoon and welcome to this session.
Resilient and Sustainable Health Systems. Together with the 5 distinguished guests, we will discuss concrete initiatives to support this agenda. Thank you for all of you to joining us. Je salue les participants.
I would like to greet our online participants. We have interpretation online and on site. Now, the Constitution of the World Health Organization remains incredibly modern. Now, in the framework of the Paris Peace Forum, here is a paragraph that is particularly interesting. The health of all people is a fundamental condition for peace and security in the world. It relies on close cooperation between individuals and between states. And I do believe that this forum and this session will help uphold this agenda. And the most famous quotation from the Constitution of the WHO is as follows: health encompasses mental, physical, and social well-being, and not just the absence of disease. And the main message of this forum is all about building back better. In a context where COVID-19 continues to take lives, to put our economies and our lives on the line. And we have a number of projects that have been selected by the Paris Peace Forum, which have provided solutions to these issues.
Very quick and calls for a short but very important answer. How do your respective projects contribute to the need to benefit from resilient health systems and are able to respond to sanitary crises? Maybe I'll start with you, Tianyue Ma. You're associated researcher in the Division of General Affairs at the China Center for International Knowledge and Development, and you represent the project Resilient Asia Network Against COVID-19. Thank you so much for joining us, and the floor is yours.
Thank you. And thank you everyone for the opportunity of sharing this Resilient Asia project in this highly prestigious forum. The Resilient Asia project is launched to map out the best fit practices in individual national contexts. And we got cases of Korea, Singapore, and Malaysia to generate knowledge and improve health systems resilience for countries of different levels of development and different health system capacity. And here are the key findings from this project. First, we find that coordination is key to system resilience. During the pandemic, the Korean and Singapore government demonstrate their effectiveness in cross-ministerial coordination and collaboration with public and private actors. They both activated the emergency response system at the beginning of the pandemic, so that multiple ministries and departments are involved to enact policy responses to COVID-19 across a wide range of domains and issues. And for public-private collaborations in Korea, the KDCA, the Korea Disease Control and Prevention Agency, collaborated with private firms to enable mass production of the test kits, and also merge the separate spatial databases for different companies into one integrated geospatial database so that government can efficiently trace confirmed patients. And the second thing is that health system capacity is important. And that includes number of health workers, hospital beds, availability of medical equipment, technology capacity, and capability of mass production. So in Korea and Singapore, healthcare system is well developed, and the highly efficient and well-resourced hospitals, well-trained healthcare workers, and extensive network of primary care clinics and facilities have ensured the healthcare services to COVID-19 patients to be available. And they also have advanced technology and manufacturing capacity that enable to quickly develop tools for tracing, testing, diagnosis, and adequate supply of medical products during the pandemic. And the third, we find that the existing economic, social, and political problems could be the trigger of health crisis. So, for example, migrants usually suffer problems of overcrowding, low payments, and underinsurance. So, when there were cases found in this group, it would soon spread to a large number of population, making the situation very serious. So to care about and solve the existing social problems during a normal period can make the system more resilient during a pandemic. Thank you.
Thank you so much. Thank you, Tianue. I will move to Nelson then, and after Esther, so that you can prepare yourself. Nelson Olim, you're head of simulation learning at the WHO Academy, and please tell us more about this initiative and especially the program on simulation.
Thank you, Tana. Thank you, Tana. Actually, this is the new, I would say, the newest program out of the WHO Academy, which is a newly established division inside WHO, highly supported by the French government. And this program, basically, I would say the main goal of the program is to give hospitals, especially emergency units, the tools they need to deal with mass casualty incidents. It's a program that has been designed to be resource agnostic and context agnostic, which means it works well in any hospital in the world, regardless of their level of resources. What we found out is that having resources, and if you do the analogy like building a house, having the resources is just like a pile of bricks. You need a system to turn those bricks into a facility. And so the program basically gives emergency units the system they need to use the resources they have to cope with any type of mass casualty incident. Now, of course, we are talking about pandemics today, but before you can actually deal with pandemic, you need to have a core system that allows you to deal with smaller scale events. And this is what we're giving, is the core structure that you need, and then you can build upon and respond to pandemics, chemical, biological, radiological, nuclear events eventually afterwards. Thank you.
Thank you, Nelson. Esther Kofra, thank you for joining us. You are the Executive Director of Faster Cures at the Milken Institute, and you represent the project, A Global Early Warning System for Pandemics. Please, the floor is yours.
Well, thank you so much for the opportunity to be on stage and certainly to share about our initiative through the Milken Institute. Obviously, we have seen the devastation of the COVID-19 pandemic and has highlighted the gaps in health resiliency of healthcare systems, but it's also highlighted the gaps in a global early warning system capabilities to be able to identify pathogens of either an epidemic or a pandemic potential, to characterize the risk of those pathogens, and then to develop a network to contain and create a response mechanism for that potential threat. So we launched an initiative through the Milken Institute in support of the Rockefeller Foundation Pandemic Prevention Institute to really work on just that, creating a network of networks of systems to identify how can we characterize risks of pathogens that are either circulating in an animal reservoir or with human populations pre-event, and capture early event information to create a technology-based solution to share those data and those insights with local health authorities, with regional health authorities, and with global health authorities. We initiated a paper and wrote a paper that we released in June that outlines the vision for this system. And it's really focused on building local capacity and capabilities, that we're building on top of the infrastructure that's already been developed to help with health systems response, but adding on top of that and bringing together non-traditional data, mobility data, for example, wearable data, to allow us to be able to identify hotspots around the world where there's a potential for spillovers of these pathogens, where we can identify, characterize those risks, and enable an effective and efficient response system. Of course, important to all of this is working alongside established institutions. The WHO has surveillance institutions, Majority of them are focused on event-based surveillance. When these are already occurring in human population, we can add on top of that, bringing in the private sector in particular, but working along these existing initiatives to identify and create this risk dashboard that creates this insight that allows us, again, to better identify and mitigate potential threats.
Thank you. Thank you so much. I will move to Jose now. Jose Velasco, thank you. You are a lawyer from Venezuela and Colombia, and you are the coordinator of Peace Building and SDG 16 coordinator at the Juventud Unida en Acción, and you lead the project Mental Health for Peace Building. Jose, as the pandemic context makes us realize that how valuable mental health care is in our societies, how will your project support this agenda?
Thank you so much for participating on the stage. Our project will support this agenda, and promoting aware about mental health is a human right and public responsibility. And this means putting on the public agenda, and this is necessary to invest in mental health, and for all not leaving no one behind. Our training program guides young people to lay in countries in conflict. These basic tools are identify anxiety, depression, stress of mental health, condition and the symptoms. And finally, during this training, we collect that about mental health with our mental health barometer, and to identify what were the essential factors this affect mental health of young people living in countries in conflict. Thank you.
Thank you so much, Jose. And to finish, Burija Apuarashi, thank you for joining us. I recognize the United Nations flag at the bottom of your screen, so we can imagine that you are from a United Nations organization. You are from UNDP, the United Nations Development Programme, and you are climate change and environment team leader. You represent the project Sustainable Health Care Waste Management, and please tell us more about it.
Thank you very much. Thank you for the opportunity to share our experience on healthcare waste management project. The project is based on a rapid assessment conducted in 2020, together with the Ministry of Health and Department of Health Service in Government of Sri Lanka, where we targeted both public and private sector healthcare facilities to look into the healthcare waste management processes currently under implementation with the pandemic. The assessment revealed lots of gaps in the healthcare waste management system in the country. These include gaps related to waste segregation, data management, final disposal of residues, poor working condition of healthcare sanitary workers, especially the women, poor and adherence of healthcare waste management standards. So the project was, developed and designed and developed in order to address some of these issues or gaps identified in the rapid assessment. First thing we have done is, together with the government, develop a national action plan for healthcare waste management. And then now we are developing and designing and developing comprehensive, localized, gender-sensitive healthcare waste management systems. And the idea is to demonstrate the lessons where the other healthcare facilities can adopt easily. We are also looking at building partnership with the private sector, small and micro, medium enterprises, to look at other value additions in waste management stream, and also looking at building the standards, the healthcare waste management standards. We have the current standards set up in 2001. The idea is to review this one and update the national standards in order to address the ongoing issues. So the idea is not only, preparing the health system to address the current challenges when it comes to healthcare waste, but also building their capacity to face the future pandemics. Thank you very much.
Thank you. Thank you very much. And as we are dealing with hospital management, I would like to ask you a question, Nelson, on the specific context of mass casualties. When hospitals are overwhelmed with influx of patients, how can we improve the preparedness and capacity of hospital emergencies unit?
That's a very good question. I think one of the initial statements of this panel was how underinvestment in health systems actually revealed so many gaps that were previously unknown, some of them. I do believe that underinvestment in health systems in particular is like choosing a cheap car insurance. It will cost you much more in the future if you don't invest now. And of course, we know that every hospital is different and every system is different. But I would say, looking at the mass casualty, from a mass casualty point of view, I would say there are 3 points that really should be taken into consideration. First is actually that every hospital should have a mass casualty plan. And if you don't have one, I really invite everyone to take the new WHO mass casualty management course. It's really, I would say, it's the state of the art in terms of mass casualties, adapted for everyone. And so the first thing is you need to have a plan. The second is you actually need to drill that plan and you need to test it. And many hospitals in the world, when the pandemic started, went to look for their plans, because most of them, they knew there was a plan somewhere, but it has never been tested before. And so drilling the plan is very important, and I cannot overemphasize, let's say, this statement. Pilots in aviation, they simulate every 6 months a very rare event that it's, for example, losing both engines of an airplane. It's a super rare event, but still they test it every 6 months. Our health systems don't test their capacity in such a regular basis, and we need to drill regularly, otherwise we will not be prepared. So having a plan is the first one. Testing the plan is the second one. The third one is actually having just-in-time training solutions so that you can do task shifting with your staff. So the pandemic actually revealed, for example, that we were very short on ICU and critical care, doctors and nurses. But with the right just-in-time training solutions, you can convert staff from other departments into critical care doctors and nurses if those training solutions are available, either in person or digitally. So we are also working towards that, having these solutions ready so that when the time comes, you don't need to create a course, it's already there.
Thank you so much. So we understand now that cooperation is really key to get better prepared. And I have a question for you, Esther. At the national level and maybe across borders, how can we improve this cooperation between actors?
Yes, that's a fantastic question. I think the first thing to recognize is that everybody plays a role. The government plays a role, the private sector plays a role, and civil society plays a role. And we need to understand what are the incentives that motivate each of those parts of society in order to help us to be better prepared in the future, again, either for an epidemic and or a pandemic. When we think about the role of the government, first we need to identify exactly what are the resources that are going to be needed and the political will to say that we're going to do things differently. And certainly COVID-19 has illustrated that we do not have the benefit of waiting for yet another pandemic of this size and nature. What are the investments that need to be put in place now? And what are the commitments that are going to be needed, including from the private sector, to help the governments really develop their capabilities in terms of their response? And secondly, for example, with COVID-19, we were able to develop medical countermeasures. So if we want cooperation and data sharing in the future, we need to make sure that all countries around the world benefit from those medical countermeasures, whether those are vaccines or whether those are therapeutics. That trust will allow us in the future to be much better prepared. In terms of the private sector, we need to understand that the private sector, they have capabilities. When we think about where we are from a public health perspective, there are many capabilities in the private sector that we did not bring to bear. Technology, analytics, platform, know-how are all potential opportunities. And now certainly is the time to look at all of those various roles for the private sector to play, of course, with those appropriate guardrails and ensuring trust. And the final is the civil sector. The civil sector certainly has a role to play in building trust and creating an intermediary between all of those actors that we talked about. How do we empower individual citizens to recognize that they have a role to play? We have deep penetration, for example, of cell phone use. It allows individual citizens to, again, play their part in terms of public health preparedness. So when we think about cooperation, first of all, is establishing what are the urgent priorities, and that should be established at the global level. It should be established at the national level. And then how do we empower all of those actors within the ecosystem to respond with their own capabilities?
Thank you. And on the same wave, Tianhui, how to foster exchanges and best practices in real time to collectively finally improve the response to future pandemics?
I think the question is very good, but actually I think it's not an easy thing because different countries have different cultures and different institutional contexts. Measures that are effective in one country may not work in others. And
We've lost the connection. Maybe we can wait 2 or 3 seconds. Okay, I will go back to Tianhui later, but if you allow me, Jose, I have a question for you, specifically on mental health. Mental health issues are now recognized at the international level and by the WHO as the primary healthcare topic, and it is critical to building resilient, sustainable health systems. But at this stage, do you think it is now really a given for every policymakers?
No. In most of the countries, and especially developing countries, access to mental health is no guaranteed to all. People who require psychology and psychiatry care how to face to like cause of mental health. Current policies have to not fully include the issue of mental health. In Latin America, only between 1% and 5% help bugging for to mental health. And therefore, we want to highly to need to guarantee access to mental health on the human right and the public responsibility. We believe that to achieve sustainable pace, we need to ensure mental health for all. Thank you.
Thank you very much. Finally, many of your projects are based on actions aimed at strengthening capacities through training, networking, awareness raising. So human resources for health are the heart of health systems. What would be your advices to accelerate actions in this direction, and what do your project brings on that? Maybe someone, one of the panelists can start on this question. Nelson, it seems that you are moving.
I mean, it is a really good question. Again, I'm going back to the idea that we really need to invest in the health workforce and how critical it is to invest in the health workforce. I mean, there is no healthcare without health workforce, and I'm not going to talk about working conditions. It's outside of the scope here, but the need to capacitate a health workforce by providing them in like learning solutions that go beyond just the simple knowledge transfer, which is a lot of the times done, but actually look at their decision-making capacity, their task competences. And we know today that we are already 7 million short in terms of health workforce. We estimate by 2030 to be 18 million short, so the gap is actually growing. And then on top of these, there are events, of course, that, like for example, Sierra Leone, the Ebola crisis in 2014. I mean, 21% of the health workforce died in that event. So there is clearly a need to promote the health force, to give them the conditions and the training they need to be able to basically to flourish and to do their job the best way possible.
Thank you, Nelson. Yes, it seems that Esther, you would like to jump in. Go ahead.
Yes, I wanted to add on top of those wonderful comments and absolutely agree that we need investment in the healthcare workforce. When we think about the response to COVID-19 across the world, what we saw were healthcare systems that were strained sometimes to overcapacity. And that's due to the lack of investment that we've had in that healthcare workforce over decades. And when we think about how do we need to be better prepared for the future, so much of that preparation lies in reinvesting and strengthening local healthcare systems and networks and providing that technical assistance. When we talk about, for example, diagnostic level testing or PCR capabilities within countries, for example, much of those technologies were not widespread. Now they are. We need to invest in how they can become even more sustainable. And in particular, when we're trying to identify novel viruses, for example, the healthcare workers that we need in the field-based settings are going to be drawn upon from responding to care. So we need to make sure we're adding resources, not taking resources away at that local level.
Yes?
This is Buddhika.
Yes, Bodhika, please.
Thank you very much. I think when we are discussing about the capacities, I think we have to also think about the clear and strong link between the environment and the pandemic, and building our capacities, not only the responding to the pandemic, but also looking at the other dimensions like protecting the environment and looking at the well-being of the larger population when we are responding to the pandemic. Now, when we look at the nexus between the environment and the pandemic, there are both positive and negative impacts. Positive impacts, obviously, due to the pandemic-related lockdowns, decrease in community inflow, decrease in economic activities, and we have seen some improvement in the air quality, the water quality, and the reduction of the pressure on the biodiversity, especially the wildlife. But at the same time, there are so many negative impacts are coming, especially related to, that is what we have learned through our engagement with the government of Sri Lanka, especially related to the healthcare waste generated through this particular pandemic. And the data shows that there's a five-fold increase in the medical waste with the pandemic. And countries like ours, the most common practice even for the healthcare waste is open burning or open dumping. And I'm saying this because in 2019, the National Audit Report reveals that 70% of out of the audited hospitals, they have found that about 70% of these hospitals do not have proper healthcare management systems in place. And these are creating additional problems. So if the common practice is open burning, we know that there are the high potential of releasing persistent organic pollutants, dioxins, furans, creating problems about air quality. If these are open dumping, then these are creating lots of problems for water quality, contamination of soil, and also problems to the wildlife. And not only from Sri Lanka, we have seen photographs from many other parts of the world that the wildlife entangled in face masks and other PPEs, because we have seen this, the lack of adherence to healthcare waste management standards are creating problems in all over the world. So it's really important that we understand that the health staff is, they are under pressure. The lot to be delivered with very limited resources, but at the same time, we have to also look into the other dimensions of the pandemic, like environmental issues.
Thank you, Alika. Let's move to the Q&A session now, and maybe I will give the first question to Tianuema, because as you are back, and the question is related on the answer you started previously. The question coming from the audience is how we can collaborate more effectively across borders when it comes to health systems.
That is the question, and I was thinking, and we are planning to do research on that area, and in the next step of our Resilient in Asia project. Actually, we plan to focus more on cross-border initiatives and like establishing cross-border response system, and that may begin with the cross-border surveillance system, and from information sharing to cross-border tests, and then we would consider to research on the mechanism of cross-border monitoring and distributing emergency medical supply, such as vaccines and PPEs. So yeah, that's our plan for the next research project, and we look forward to new findings.
Thank you. And please feel free to jump in if you have something to add to the answers. I have a second question for you coming from the audience. The second one is, what was the health system's biggest weakness during the pandemic? Big question, you just have 2 minutes. Who would like to answer this question? Esther, maybe?
Yes, happy to start. Well, there are many factors at play in terms of the health system's greatest weaknesses. One, lack of preparation, certainly being caught without adequate awareness of the scale of a potential pathogen that we experienced of this nature. Not having the adequate resources to get to, whether it's masks or other kinds of PPEs being readily available. I also think not having a good communication infrastructure to describe the risk and benefits of different mitigation efforts was certainly also a challenge. Of course, with our project, the biggest weakness that we're working on right now is how do we develop the capabilities and identify the core data sets? What are the key questions across so many initiatives that are occurring that are able to help us better predict where there's a potential for spillover event, right? We have all of this technology as a global community, but we don't deploy that technology, and certainly not leveraging all the data that we have in our health systems. And that's where our focus is right now, to strengthen those capabilities and to bring other players and other partners, particularly leveraging other types of non-traditional data sources into such systems.
Thank you, Esther. Nelson, Boudica would like... Boudica, go ahead.
Let me also share a couple of thoughts from my side. I think I feel there are two strong points. One is about using data and digital solutions for decision making. I think the health system, in general, is very capable of managing certain types of data, especially related to patient care. But in some areas, especially related to, in our projects, we have realized that there are certain gaps when it comes to data management and using information or to make informed decisions, evidence to make informed decisions. Second area is partnerships and collaborations. Health system, by its nature, is it's a sector working. They are equipped with all different services, so they are usually working in a silo. But when we really look at this kind of a pandemic, you have to also coordinate with other partners like the development partners, the funding partners, the private sector, civil society, bring with the community. So these are, I think, the areas that we have to seriously think and build our capacities and as the way forward. Thanks.
Thank you, Ulrika. Nelson?
Yeah, well, I will probably add two factors here, two additional ones. One was I'll say the lack of capacity actually to keep business continuity, because at some point in time, actually, it looks like all resources were actually diverted to respond to the pandemic, and so many patients were left behind with other types of pathologies because the system was not I would say efficient enough to keep business continuity. That's one, and the second one, I'm going back again to learning and how the systems need to be more flexible to allow for quick task shifting, because it's so important to reallocate the resources to where you actually need them, and I'm going back to the need to have just-in-time learning programs that allow health workers to shift from what they usually do or what they've been doing in the last 5 or 10 years to something that is slightly different, but which competences they can actually gain if the right program is in place. And so I would say flexibility, clearly it's something that the systems need to acquire.
Thank you so much. I tried to kept some thoughts and some ideas coming from you, dear panelists. Allow me to read them. We have the fact that it is really important to think from local to global, to foster cooperation and communication, to generate knowledge, to have intersectoral answers to health issues, to have resources, health workers, equipment, technologies, to turn bricks into a system, creating networks and networks of networks, to also have a human rights agenda embedded in the health agenda, to have a partnerships plus the involvement of civil society when everyone plays a role and trust is key. Is that list correct for you, or do you want to add something to this kind of synthesis? Vulika.
That's a fair collection of the ideas. I think that's largely that is the discussion is about. And I'm still prefer if you can also consider one of the takeaway points, the nexus between environment and the pandemic, especially the epidemics like this, and we have to pay more attention on our environment as well. Thank you.
Esther, would you like to add something?
That was a very robust list. I would also add on top of that, maybe to bring it all together as a cohesive whole, establishing international health priorities and reflecting from this past pandemic, we have cycles of boom and bust where a lot of attention is put on the response for a particular crisis, and then we go back to business as normal. So how do we establish new international health priorities that can take all of those things that you identified on the list and put them into a strategy for how we go forward?
I move now to Tianyu, if you have something to add.
Yeah, I think that's perfect, and I agree with all of you. Yeah, no point need to add.
Thank you. And Jose, I suggest to add mental health as a primary healthcare issue and to add it at the on the agenda at the highest level.
This is Pandip, the demonstration of the silting need inversion was also mental health. Thank you.
Thank you, Jose. Nelson? Your final words?
Yeah, I mean, it's hard to summarize when everyone already said everything that I think it was really important. I mean, maybe a final thought that we're not all in the same boat. Some systems were hit very, very hard, especially those that are already fragile from the beginning. And so I think we really need to focus. And many, I was just thinking here about so many in conflict settings where on top of the conflict, then you have a pandemic and the need that we really need to support these systems that are even more fragile than all the others.
Merci beaucoup.
Thank you. Thank you very much. Thank you to everybody. Thank you for having come and presented the projects which contribute in the field of health, creating resilient health systems, and which finally ensure peace and security of citizens everywhere on the planet. Alas, we haven't all been able to be together physically, but technologies have allowed us to spend this time together and to share our convictions, our projects in the field, and our desire for cooperation at the international scale, at the global scale. I hope we'll have the opportunity of meeting all together with you, dear panelists, as well as all the participants. Thank you very much and have a wonderful day.